Hi, good afternoon, everyone. Thank you for joining the United States Breastfeeding Committee webinar. We are glad to be here. Our webinar is titled Advancing Birth Equity Through Leadership Development for Community-Based Birth Workers. The objectives for these webinars are to identify 1 to 3 barriers and potential solutions for birth equity grassroots leaders in their community to work to address systemic change. List 3 positive impacts that were identified via the implementation of the Birth Equity Leadership Academy. Discuss 3 ways we can support grassroots leaders of color to address birth equity. If you're not familiar with HealthConnect One, we are a national leader in advancing respectful, community-based peer-to-peer support for pregnancy, birth, breastfeeding, and early parenting. So we're a national non-for-profit that does consulting and training on maternal child health. We are grateful for the support of the W.K. Kellogg for this work. What is Birth Equity Leadership Academy cohort? About BELA, so HealthConnect One's Birth Equity Leadership Academy brings together diverse cohort of trailblazers and experts, leaders to mentor more than 100 community leaders from across the country. They're working locally and collectively to achieve equitable support and for birthing families. The purpose of BELA was to strengthening the national network to promote birth equity through education, communication, capacity building for innovation and change. Part of this initiative included a mentorship piece where it was a non-traditional model. We had researchers, midwives, birth workers, doulas, peer counselors, organizers, different skill sets, and paired them up with different skill sets. In addition to that, we also had webinars that were hosted by BELA leaders themselves. We included retreats and regional convenings because this is very important to our work. This is an opportunity where we both mentees and mentors were able to come together to build relationships, but also to connect and support one another. This is really important piece for us because a lot of people of color don't necessarily get that opportunity to do that due to financial barriers or access. And these were free and available to the community and to BELA participants. Another component of this was the BELA community projects. So this provided financial assistance and technical assistance to all BELA leaders. It provided an opportunity to foster collaboration between BELA leaders. It provided an opportunity for people to share learnings and network with one another. Opportunity to support the work that was happening already or new work or ideas that BELA leaders had around birth equity. We had the honor of co-creating this application and this process with BELA leaders and staff. And we also provided a webinar for BELA participants about this opportunity. We worked with a committee that was composed of both BELA staff, faculty, leaders to review and select BELA community project applications. We received a total of 43 project applications that were submitted to us, and that was a total request of $500,000, which really lets us know about the need for our communities to address birth equity. The BELA community projects, the awards vary in different amounts that are listed here. We were able to award $80,000. As you could see, that was not the $500,000 that was requested. And this was supposed to be spent in a period of 12 months. Here's a beautiful picture, with the exception of one leader that's missing, who received the seed fundings to implement projects in their community. And I think it's really important to, look at the impact of these financial awards that really provided a lot of growth learnings for BELA leaders. Some of the things that we learned in terms of BELA community projects was that it was important for us to provide verbal encouragement, also extend the deadline. That increased the opportunity in terms of the number of BELA leaders that applied. It gave us an opportunity to also look at how managing tools that we can share with BELA leaders that submitted projects to manage their funds. We looked at what was going to be the impact of that BELA leader for receiving that funds. And what this means is because if they were not linked with a non-for-profit, this would probably impact their income tax when they would have to file that. So these were things that came up that we didn't think about, but that we learned right as we did this project. We also learned really quickly that we couldn't distribute projects the same, the funds the same. We had to distribute the funds based on the project needs for that specific project, and that was really important if we wanted to be equitable. We provided technical assistance with fine-tuning project goals for BELA leaders and an opportunity to access sample tools and evaluation from a consultant. So this really matters for people of color in terms of increasing the opportunity to something like this, because we know by our lived experience and nonprofit data that there's a lack of investment from both private and foundations that is a barrier for birth equity leaders across the country. So if we know that, there's already a challenge for leaders who are not linked with a non-for-profit, we saw this by the number of, requests that we got, but also we know that the newest Bridgespan report across Echoing Green, that report showed that there was a $20 million gap in racial funding between Black-led and white-led organizations. So I think, again, a lot of people of color don't get that opportunity to apply for opportunities like this because, first of all, they're not encouraged, they're not eligible to, and they might not be linked to a non-for-profit. We were blessed to have an evaluator consultant from the beginning of this project, and this is just some of the things that were evaluated. I will hand it down to Jacqueline Lambert, who is a BELA leader and also is an awardee of the community project.
Hi, everyone. As Brenda stated, I am Jacqueline Lambert, one of the BELA leaders, awardees. I always like to think about when I look at these pictures as my experience as a BELA leader. I always like to bring up the fact that when I attended a BELA meeting, I thought I was attending a breastfeeding workshop, but it turned out to be a cohort of men and women from several states sharing the work that they do. For one thing, I learned what equity really was. And then BELA gave me a voice. And when I say gave me a voice, it taught me that it's okay to speak up on behalf of the women you serve. I learned things that took me out of my comfort zone, to learn things I didn't know, but also to hear and accept truths that existed in my nation and to own those truths and expose those truths in my own community. BELA has taught me how to work on projects from planning to implementation and evaluation. BELA has also taught me how to work with people from different backgrounds, different cultures, socioeconomic status, but who all had the same goal in mind. Next slide, please. Oh, barriers in the field. When I think about barriers, when we're sitting around talking and planning, uh, any type of barrier I think of would be implementing the project would be a barrier of self-limiting. We're our own barrier because we believe others will not listen to us, or we will not have the help that we need, or that we're not adequate enough, or we're not educated enough. We play out a million scenarios in our head way before we start implementing or planning, and those scenarios become our barriers. The solution I've learned for this barrier is to be confident in the work that you are thinking about doing, and the belief that your community will benefit from that work. It is also important to be hopeful and positive, that even at first, if you don't have the support, but the confidence that the community will benefit and you will keep moving. Next slide, please. For this project, we had 3 goals, but during the project, the name went from Let's Talk Baby Support Group to Let's Talk Baby Cafe. Uh, the name change came about because the community I serve in was not rallying around the support group. It just wasn't going off that word support group. And after taking a survey with the community stakeholders, I realized that changing the name would be best. With the name change came also using the Baby Cafe USA model, which was a great idea because you had access to the logo, the material, and all evaluation forms. This name change anchored me in the community as an approved support group, where the community didn't have a problem using the cafe as a resource organization for prenatal and breastfeeding mothers and their families. We have started a good work, but the numbers do tell us that more work is needed in the Mississippi Delta. The numbers also show that the people in the community trust the work of the Baby Cafe in the community as a reliable resource. Next slide, please. Oh, so remember I said we had 3 goals, and one of those goals, our first goal of the project, was to actively listen to the moms. One of the steps for achieving this was to create a safe, non-threatening atmosphere where 25 women could meet on a monthly basis to talk about their pregnancies, childbirth experiences, and other issues that may concern them. Next slide. Our second goal was to provide information and education and support to achieve their individual goals. The steps to achieve this goal was to counsel 25 families and provide information, education, and support based upon their individual goals that they had set for themselves. Next slide. And our third goal was to expand and provide resources for 100 families. The steps to achieve this was to conduct 2 community baby showers, participate in 2 baby fairs with the goal of reaching 100 families. Next slide, please. Well, the Baby Cafe was much needed in the community because it gave the families another resource in the community that empowered them to receive education and make informed decisions about the care they receive. The Baby Cafe also became a breastfeeding resource outside of the local WIC health department that they did not have before. Next slide. As we had another positive effect was that the visibility of the program was increased because of community involvement. The community spread the word about the new resource by placing it in the local newspapers and calling the local news stations to come out and tour the facility. Next slide. Some of our biggest takeaways when I look at the data, we reach more than 25 families. The data from the conception of the project, we served 185 families. We over exceeded our goal for the baby showers and baby fairs. It did show me that there is strength in small communities when we come together and allow all voices to be heard, and when we listen to the community. Next slide. Without the funding support of being a BELA awardee, we would have never been able to achieve these goals. Even though we had what I consider great successes, there is still a lot more work around the disparities in breastfeeding in small communities. Next slide, please. And how can we help? We can continue to support grassroots leaders by listening to them, looking at all the possible ramifications of how the project can assist communities. People of color can best relate to their communities better than anyone else. When we're looking to work in those communities that are non-white, remembering that there are capable people in the community who look like their community and who are qualified to help their communities. Support their efforts by attending events, collaborating with them, and celebrating in their community's successes. If there needs to be more training, send them for the training and support the passion that they have. Next, you will hear from Monica.
Hi, everyone. It is a great pleasure to be here and to talk to you about my experience with the BELA Academy. Next slide. So I want everyone to just take a moment and think about if you've ever been in a place where nobody looked like you. How did that make you feel? Next slide. We from the BELA community, we come from communities that we serve, but this work is exhausting and stressful. And although it's super rewarding, sometimes it feels lonely. So we need spaces to regroup, recharge, and to receive professional development. And I feel like that's what the Birth Equity Leadership Academy was to me. What did the BELA leadership offer me? It offered peer-to-peer support. I got to meet amazing people doing amazing work and experiencing similar experiences from all across the nation. I got to acknowledge that I do have skills, and it lifted my confidence to be able to continue to do this work. I got to support other people in the work, to learn from their experiences and to access growing opportunities. And all of this was centered around equity and around ourselves. Next slide, please. So BELA Leadership Academy provided mentorship. It provided opportunity for measuring of success. It provided webinars, retreats, peer learning, and empowerment. One of the things that I love about the mentorship experience was that I was able to talk to different mentors and different people and learn from them and learn from my peers. There was an opportunity when I was talking to a person, a mentor, and we were discussing event planning. And one of the things that she said, she reminded me that we as Hispanics, I'm Mexican and she's Mexican, that we already do event planners. We plan quinceañeras and bautizos. So planning another event was just a similar experience. It also taught me how to measure success and how to see that success in a different light. We could see something like only 20 people showed up, or 20 people showed up, right? There is a different viewpoint of seeing it as a failure or a success. And I learned to see the successes of the event. I got to experience different types of webinars. With our community projects, we had the opportunity to practice, do a practice run and present to our peers about our project. Some of us had not had as much experience to do webinars. And so we were able to do it in an environment where we could learn from our peers, learn best practices, and lift each other's voices up in a way that we felt comfortable and supported. I got to hear from my other peers that did additional community projects like Robe and the New Mexico Doula Association and Jaqueline. I also never knew what a retreat was. I just thought it was another training. I didn't know what a cohort was either. I just thought it was, just going to another conference, going to another training like I had gone before. And then I got to the BELA retreat, and I found that it's not just another training. It's an opportunity for growth, for development, for refreshment, for getting to actually relax and rethink and restructure and re-strategize and meet amazing people and make new friends and start creating a village that maybe at home you don't have. I got to learn from my peers. I got to build my village. We created a Facebook group where we support each other, where we inspire each other, where we talk about the work that we're doing. So then we get more inspired and energized and start brainstorming how we can do it in our communities, or what change needs to happen. And I got to feel that I know what I'm doing. I got to find boldness in the work that I'm doing. When the scholarships first came out for the community project, some of us were working on that, on applying for the community project funding, and the deadline was fast approaching. And I myself was trying my hardest to finish, but this was the first time I was writing a grant out by myself. So this was very much a learning experience for me. And then the deadline hit, and I thought I wasn't going to make it. I just kind of gave up. But there were other leaders that reached out to BELA and asked for an extension. And I learned that you can do that. You can totally reach out to the leadership and say, I need more time because my work is important. That was a most valuable lesson ever, to be bold about my work, to be bold about asking. Next slide. So my project involved creating collaborative spaces and bridging the gap between hospitals and community. Through my life experience as a peer counselor working in the hospital for many years, I realized that doctors don't really know about community programs, and community programs want to reach pregnant and breastfeeding families, or pregnant and families with newborns, and they have a hard time doing it right after the parents have delivered. And I also know that parents are needing that support from the community, needing that support from their healthcare providers. So reached out to some stakeholders on an event that already is happening, which was a hospital summit. And we decided to leverage our resources and build on to something that already was happening. We knew that providers were gonna be coming to that hospital summit. So we reached out to our community organizations so that people could start getting to know each other, could learn from each other, learn about the different organizations, and all over food, which is the best way for me to get to know someone. Next slide, please. So what happened there? People met people, people talked, people formed connections, people formed relationships, people learned how to support each other, and ultimately, people learned how to support their communities, their new parents, their new families. We did this through a graphic recording of the event as well, which serves as a visual memory of what happened during those days. It also helped during the summit to continue the conversation over lunch and over break and during the community gathering. It helped to reflect on it, to think about what had been happening, what had been learned, and to develop the next steps. And through that, we all learned how to continue to work together, to continue to build those bridges, and to ultimately serve our families better. Next slide. So what did I get from being part of the Birth Equity Leadership Academy? I found my village. I found my community that we are groundbreakers and earth shakers. We do things different, but we do them well because we come from the community and we know what our community needs. We support each other, we help each other up, we lift each other's voices. We attend each other's events and trainings and cheer each other up. We grow together. I have grown so much since I started. I have become more confident. I have become more aware of my skills and my strengths. I have learned to ask for help. I know who I can reach out to for my BELA leaders if I need a speaker or if I need to talk about a specific topic or if I need to just brainstorm. And I am continuously inspired by every single one of my BELA leaders and mentors and the work that we do with HealthConnect One. So what we can do with that is we can come back and change our communities and support our communities and lift the voices of our communities. And with that, I'll give it back to Brenda Reyes.
Thank you so much, Monica, BELA Leader and BELA Community Project Awardee. Thank you, Jacqueline Lambert, BELA Leader and BELA Community Project Awardee. If you have any questions for us about this project that we were so happy and glad that we were blessed to do, feel free to contact me, Brenda Reyes, or Jacqueline Lambert, or Monica Esparza. Thank you so much for your time.